Uganda 24/7 YouTube channel. Please subscribe, share and comment.
Like any other baby, I delivered by scissor. She cried. She didn't get any oxygen or any need to support her breathing. So we did not even notice, because I delivered from a hospital, but we didn't even notice that Abigail had a heart problem until she was about 30 hours old. Then I realized she was not breastfeeding well. She was not active like any other baby. Somehow I kept saying maybe she's tired, maybe because there is not enough milk. When it comes, she will breastfeed. But until around, because I delivered on Monday midday, until Tuesday at around 4 p.m. when I got so concerned, I asked the nurse, like, why is my baby not breastfeeding well? Then she told me maybe, let's check on her sugar levels. So at that point, she was dressed, like she had gloves on her hands. It's okay. So they had to remove the gloves. They removed the gloves to check for her sugar levels. At that point, they noticed baby's hands were black. They did a little exam, and the mouth also was blue. The toes were blue, like generally her extremities were blue. So the nurse was very concerned. Immediately she brought some machine to check her oxygen levels. Checking her oxygen levels, they were down. Like they told me they were 50%, which is really low. So they rushed the baby to the intensive care unit for babies. They did the scan for the heart. Within an hour, they called me. They told me your baby has a heart problem. Because there was a cardiologist at that point. The cardiologist told me your baby has a heart problem and she needs urgent surgery. As urgent as 1 week before she makes a month. Then she told me the worst is we cannot perform it in Uganda. We have to transfer you. You have to go abroad, that is India, for her surgery. But the best results are achieved when before she makes a month. Now they referred me to Heart Institute. But before referral, they told me she also has a hole on her heart. But that hole is the one that is helping her survive. And unfortunately, the hole is too tiny and it can close any time as she grows. So they told me, now we're going to do a temporary surgery to enlarge it because it is the hole that is helping her survive. But still that is not done here. We shall refer you to Heart Institute. So they made arrangements and they referred me to Heart Institute. So while we were at Heart Institute, at 3 days old, they performed that surgery. And it was successful. Actually, after theater, a doctor came and told me, your baby is out of theater, she's in ICU. You can go and check on her. I reached there. I saw they had wrapped her very tiny in bed, but she was still asleep. So the nurse told me, you keep checking on her. When she wakes up, you'll be able to breastfeed. That was around, they took her at 1 p.m. At 5 p.m., the doctor came and gave me that news. So I kept checking on her until around 7, when she was now fully awake, pulling things, trying to cry. Now actually she could even cry, which was not the case before. So at 7 p.m., I tried breastfeeding. And she really suckled. She was now suckling well. So they kept us in ICU for that night. In the morning, they transferred to HDU. We were in hospital for 2 weeks. She was trying to stabilize until the doctor said, now, I think you can go home and prepare yourself, look for money so you can go abroad. So they discharged us. But before they discharged, we had tried to apply to some organizations which they had given us that can help sponsor. So we went home, we started preparing the documents. Of course, we didn't have money. We tried to look for money, and she's ever sickly. So we tried to move to different organizations. So, in the process, I didn't have a passport. They required one for her. So the day I got the passport, the lady called me and told me, it is so unfortunate that we cannot work on your baby. Then I asked her why. She's not fit for the surgery apparently. Well, her heart was contracted. That's what they told me. That the heart was a bit swollen. So they told us maybe you can wait until she makes 6 months. But for now we can't hope. So we lost that surgery of 1 month like that. So we were there in and out of hospital. She kept growing until she made 6 months. So when she made 6 months, I went back to hospital. Then they told me, so we started the process. But meanwhile, we had also applied in other organizations. Like there's one called Indian Association of Uganda. We tried, but they are not giving any feedback. They've only responded recently in Feb, it was 3rd of Feb, when they told me, we are sorry, but you can try another organization.
They didn't give you reason as why they felt they cannot be of help?
They didn't give me any reason. But they kept telling me, wait. But as we went back for reviews, doctors could tell me, this is an emergency. The child needs to be worked on. Because at one point they told me we were in heart failure, which is not a good thing. So when she made 6 months, we went back. They did the echo. They told me we are getting late. It is too late for her. Meanwhile, we can still have the surgery if you had the money. So it is a bit confusing and traumatizing. So now, basically they are telling us to wait. But on the other hand, they are telling us it is getting late. So when she made 7 months, I went back, they did the echo. It was still showing the baby's in heart failure, though on medication. So actually on 4 months, they initiated her on medication to be taken twice daily. But before that, when we were about 3 months, the child started crying out of the blue. She could cry, change color. Even when you try to breastfeed, she doesn't accept. You try to do anything, you carry her, you wipe her like any other baby. You try to say, maybe it is hot, let me undress, let me bathe. She doesn't stop crying. She could cry until you have to put her on oxygen. So at one point it got too tough. It was late in the night. When she started crying, she cried from around 2 a.m. up to 7 a.m. Around 7, she started convulsing. So we had to go to hospital. I rushed her to hospital, they admitted, and they managed her. Fortunately, we came out of hospital when she was okay. So in the process, those episodes of crying, the doctor advised that why she's crying, it is because the oxygen is getting low, the brain is getting low oxygen. So that's why she's being so irritable. And when she cries, she stops breathing, you see she's really craving for oxygen. So we had to buy oxygen at home. So when she cries, at least you put her on oxygen, she calms down a bit. Then during that period still, she failed to eat. You try to breastfeed, she refuses. You give anything, you express milk in a bottle, she refuses. And she was seriously losing weight. During that period is when the doctor advised maybe we put for her a tube. When she tries to breastfeed and you see she has not gotten enough, you can feed through the tube. Yeah. So that's when they came to put for her a tube at around 4 months. Apparently, how it has affected me. Like I told you, I'd been on unpaid leave for 3 months. That affected my financial status. Though I've now resumed work, but I'm worried. The fact that she's not stable, even when I'm at work, I'm still worried. Because I leave her with just a maid. I don't know. I am not sure of how good she is with her. So even when I'm at work, I'm worried. Is she okay? Because this is a child who is not supposed to lie on her tummy. She's not supposed to lie flat. You're supposed to keep her elevated. Carrying her on the back is not good. Like, she becomes irritable out of the blue. You might leave her fine, but she gets irritable out of the blue. Even when you don't know what she wants, you try to do what you think is right, but she may not stabilize immediately. So I'm worried when I leave her home. Is she safe?
Okay, given your medical background, children are supposed to go through given stages, and at a given age, we expect of them, we expect some activities about them. How would you describe your baby? At birth, then they're supposed to be sitting, crawling, and 8 months they should be able to try to stand.
Yes.
Or how would you summarize that? How has been the growth rather for the baby?
Her growth rate is very, very poor. It is really poor. Because at birth she could cry, but if you don't attend to her immediately, she sleeps off. So me, like I told you, I kept thinking maybe she's tired, maybe there is not enough milk. Probably if it comes, she will suckle, she will cry like any other baby. So I kept it at that. Then as she kept growing, when we reached 4 months, we expect a child of 4 months to be kicking, clothes, pulling this and that, but she could not. Rather, she could just be sleeping or crying. Then apparently at 8 months we expect them to be crawling, but for her, the best she can do is to sit for 5 minutes. If you don't pick her up, she will fall, she will cry, she will be very breathless, like she will be craving for oxygen. So the best she can do at this age is to sit for 5 minutes. But sitting while grunting, you really see she's in pain. She keeps saying, like that. Then eating, we expect her at least to be taking like at least 150 meals, but the best she can do is 30, 60 there.
A day?
No, like per feed.
Okay. So like in a day, how many meals are there supposed to be?
And then she's supposed to feed on demand. Like you feed every time she wants. But for her, she may want like twice. And the best she can do is 60. So it is me to say like maybe she's now hungry. I top up in that tube if she refuses.
Okay, now these health facilities you've been in and out to, I don't know whether it's only one health facility or there are 2 or 3. I want you to just break it down for us, where you gave birth from, where you were then referred to, where you are currently, and which of all these referred you to India.
Oh. So I work with Nakasero Hospital, and that's where I delivered from. They are the ones who referred me to Uganda Heart Institute. So Uganda Heart Institute, they did a temporary surgery, like I told you, to enlarge her hole, which is helping her survive currently. Then Heart Institute, they explained to me that this is a very complicated case, so they cannot handle. They referred me to India. Yes. okay, the diagnosis is transposition of great arteries. Here what it means like the two great arteries are the pulmonary artery and the aorta. So the aorta switched position with the pulmonary artery. The pulmonary artery is supposed to take blood to the lungs for oxygenation. Then the other one returns it and supplies it to the body. So this one switched role. So the aorta cannot take blood to the lungs. So her body is getting the oxygenated blood. That's why you see her hands are a bit blue. Her mouth is blue, blackish like that. Even her tongue, even when you look at her toes, they are also blue. That is why she has low oxygen levels. Usually her levels are within 60s, yet a normal person is supposed to have 90 and above. But for her, she's in 40, 50, 60. So that is the diagnosis. Her body is getting the oxygenated blood. However, what is helping her survive is that hole, because the hole is, remember the heart has four parts. So the hole is on the upper part. So blood is moving from the left, it mixes through the hole. Instead of mixing through from the lungs, it is now mixing through the hole. That's why they had to enlarge it so that blood can easily mix up. That is why I said the hole is the one that is helping her survive.
So the treatment you're seeking is to switch and reposition this?
Now they explained to me, before she made a month, they could switch the veins themselves, the artery and pulmonary artery. They take them back to where they are supposed to be. But apparently, since we've gone past 1 month, they cannot switch that. But instead, they are going to switch the whole part of the heart. Yes, which is now called the mastered procedure.